Good afternoon, everybody. Welcome all to CIDOL. Thank you ever so much for your presence here today in this opening session and the sessions that will follow during the first summer course about the European Union, which at CIDOL we have the great pleasure of organizing jointly, of course, with the headquarters of the European Union institutions in Barcelona, the headquarters of the European Parliament with Sergio Barrera as the head of the office, and of course with the European Commission's headquarters, the representation office in Barcelona. Manuel Shapiro, who has just actually come recently, and I congratulate him as director of the office. It is a great pleasure. I mean, for a few months we have been preparing this joint session, this dialogue that we will have during the next 3 days with this first initiative action. I have to say it has generated a lot of interest in both modes that we have foreseen given the current circumstances. We have a number of attendants that of course are here in person, keeping all of the necessary measures imposed by the pandemic, and we thank their presence. We thank them for their presence. I am seeing you face to face, and of course I'd like to see you without a mask, but you need to wear a mask, and I'm very, very happy indeed to have part of this course in person in this room. But a large number of attendants online who are following us from right now, and for the next days in this course, more than 500 people have registered for the following up of this course, which is something to bear in mind, given the circumstances we find ourselves in, and also the amount of content that are being offered online. And indeed, this is another added challenge that we have to face. At CIDOP, and I reckon that those of you present in person, you know it well, but CIDOP is a reference center for international relations in Barcelona, amongst the best think tanks in Europe, and we're devoted to European issues. Historically, we have an interest in that, and right now too. And what we want is to group together a number of voices from the field of research, the expert field, the experts who are here to help us analyze the challenges faced by the EU right now, but to do it not only from an expert point of view, but also to do it together with a conversation and a dialogue with the institutional side of it, the representatives of the European Union institutions, so that they can share with us and share this dialogue with the different experts who will be participating during the next 3 days. And we do it with regards to issues that are specifically interesting to us. The first and foremost one is we start a discussion here today with the response of the EU to the pandemic from a health point of view and from the point of view of the management of an unprecedented crisis. And of course, we do it with the capacity to have an expert voice from the European Union, Isabel de la Mata, who will be here with us online in a dialogue with, after the first paper is presented, but also tomorrow in the conference about the future of Europe, and we will do it on Friday as well. All of them are crucial European Union agenda issues and of the international agenda as well, crucial issues to understand the post-pandemic world. So on my side, with these institutional opening introductory words, I'd like to say that you can have simultaneous interpretation into English, Spanish, and Catalonian as working languages. There will be a mixture of the use of these languages during the 3 sessions. And the presentations will be hybrid. We will have a screen for those of you who are here in person to follow the interventions made especially from Brussels. But the rest of the people having the floor will do it online as well. And people who have come here to Barcelona and who will be present in CIDOP's room. To us, it has been a great challenge to organize this course, given the circumstances, given these conditionings imposed by the pandemic. But at any rate, it has also been a success. And considering the number of people registered, it's a real success. And I'd like to thank very much Sergi and Manuel for their trust on CDOP to organize this discussion, hoping that it's going to be the first of many, many courses in the future about European Union relevant topics, bearing the genesis of an expert institutional gaze. And without any further ado, I'm going to give the floor now to Sergi Rivera, who is the head of the European Union's office in Barcelona. Well, thank you. Thank you, Paul. Dear friends, good afternoon. We're so happy at the European Parliament to co-organize with CIDOB this first summer course about the European Union in one of the best think tanks in Europe, as pointed out by the Index think tank Global Index. And we have the pleasure to cooperate with CIDOB, with his director, its experts, and the whole technical team. This is an initiative action, as Paul has said. This is a great success, and this will not end in a first edition, but just the first of many. And hopefully the future one will be more in person and less online, especially both for the attending audience and for the speakers. Now, I'd like to share with you some thoughts about the issues we have chosen for the 3 sessions that we will have from today till Friday. The truth is that we have chosen the topics we needed to choose. There have been many others, but these are the main topics. The response of the EU to the pandemic. When the pandemic started, everybody looked up to Brussels. Everybody automatically assumed that the response to the health crisis had to come from the European scale. But right now and then, the EU has no health competencies, and things have had to be done in an improvised way based on political will. And this is how we adopted a joint strategy for the purchase of vaccines. The purchase of vaccines for 450 million European citizens was the only possible response. Imagine the scope of the crisis. If each member state had to buy vaccines on its own, there would be countries that would be fully vaccinated, others would not be vaccinated, and some would be paying a price for the vaccines and others a different price. That was a success. There have been mistakes, of course, but we went very slowly at the beginning. But now the vaccination campaign is being a model campaign. We have 45% of the European Union's population that has already completed its vaccination pattern, and 64% has received one first dose. One of the challenges that will be discussed this afternoon must be the contribution of the EU to the international vaccination solidarity. As you know, this is being done through the COVAX mechanism, which is the world system for the equitability of vaccines against COVID, which has given more than 81 million doses of vaccines to 81 countries. The role of the European Union should be one of the main roles. And then talking on the 1st of July, we have the digital certificate, whose goal is to allow movement within the EU. This digital certificate should be one of the challenges of the EU for this summer. And if any of you want to travel throughout the EU in the next 3 months, you must know, because a lot of people are asking us this. This digital certificate does not work the moment you receive the dose, but 40 days late. And we find many cases. Basically, you have to wait for 40 days, but depending on the country. In Romania, it's 10 days, for example. And as I've mentioned, each member state has its own competencies and may impose its own restrictions. If you want to go to Malta next week and you haven't got the 2 doses and 14 days, you can, your flights should be cancelled. Today, they have said you can only get with a digital certificate after 40 days. They do not accept a PCR, which is accepted in the other 26 member states in the EU. So you have to look at the restrictions one by one. And this is an example of the fact that the EU does not have a single policy in terms of health, and each member state can have its own restrictions. But this is not only about vaccines, the response of the EU to the pandemic, but also the adoption of of 750 billion euros for economic recovery. Yesterday, the Council gave its green light to 12 of the 27 recovery plans. And this is a plan that's unprecedented, neither from the point of view of the money moved nor in the mechanism, which is fully federal. And we would have loved to have a mechanism like this one during the euro crisis in 2010, but at the time there was no such possibility. Second point, the conference about the future of Europe. In May, we opened the conference that initially was foreseen 1 year ago in Dubrovnik, but it was cancelled because of the pandemic. It is the first time that they formulate a reconstruction process in Europe with a direct participation of citizens. Europe needs to make progress. That's what the European Parliament's President, David Sassoli, said in a report published in a Catalonian journal based on decision-making. It is an opportunity to think in depth about the role played by the EU and its institutional structure. The EU must gain the complicity of people. And of course, the main variable for the success of this conference will doubtlessly be the participation of citizens, which needs to be as high and as diverse as possible. And it is indeed very important to have the participation of young people to guarantee a sustainable effect of the conference. As you know, there is a multi-language platform, and about 20,000 people are already participating or have already participated. It is structured in 9 theme areas. Citizens can actually make their contributions outside of these areas and present other issues that are cross-cutting. I'd like to share with you the ranking of participation because we have the contributions about climate change or European democracy, and thirdly, cross-sectional proposals, the other topics proposed by the citizens. But at the end, it's very interesting in the queue to see that it's digital transformation, and one of the topics that people are more aware about in the street, which is migration. Migration contributions are very low. And now the time has come to participate because the conclusions will be drawn in spring 2022 under the French presidency of the Council. And with regards to the last topic, on Friday, the European Green Compact, which is the priority number 1 of the community executive in this legislature. And in Brussels today, one of the main legislation pieces have been presented, the package of measures Objective 55 that wants to reduce by 55% emissions from now till 2030. So, finally, last but not least, let me make a comment about the speakers. On the European Parliament side, we have wanted to contribute to this cause by inviting 2 speakers from the research service of the European Parliament, Alessandro Alfonso and Gregor Edward, who will do it on Friday. For those of you who do not know, the research service of the European Parliament is a service that advises Euro MPs, and they carry out studies and reports about matters concerning the EU, and they help very much in legislative activities. So if any of you is interested in consulting its publications, you can do so through our web page. And finally, tomorrow, the session about the conference about the future of Europe will have the participation as keynote speaker of one of the 9 members of the Executive Council of the conference. The Executive Conference is the body that supervises the work and the organization of the conference. There are 3 members for each one of the 3 institutions, the Parliament, 3 for the Parliament, 3 for the Council, and it's Irache Garcia, who is the president of the Social Democratic Party in the European Parliament, is one of the 3 members. I'd like to thank all of the speakers for their participation in this course, and to all of you, your attendance and your interest, and once again to CEDAW for our acknowledgement of having organized this summer course. Thank you. Well, good afternoon, everybody. I am very happy to be here today with you at CEDAW for this first summer course about the European Union. And I'd like to thank Paul for having accepted a few months ago the proposal made by our institutions, our European institutions, European Commission and the European Parliament, and for having started this wonderful project, this summer course that starts today. I am convinced that probably It's going to be the first summer course, or the first course of a long list of joint summer courses. And we see its success already in the number of people who have registered. I'd like to thank Sergi, who has helped very much the Parliament to organize these sessions. And I'd like to thank Laura from my team, who is here with us and who will be staying as well, for having brought this training project to a good end. It is a very important project for discussion and debate. And that's why it's part of the dialogue about the future of the EU, the future of Europe. And it is a project made up collective contributions for development for the EU. So I'd like to encourage you to participate proactively in all of the discussions and dialogues, because it's very important to have both your online contributions and your physical in-presence contributions of you who are physically present here in person. So there will be some high-level discussions here about key issues. Aliad has already presented most of the discussion topics. Sergi has already done so. The response to the pandemic. We will start with a message with some welcoming words to the Commissioner Kyriakide, who is our Commissioner in charge of Health, Stella Kyriakides, and we will also have an expert of a very high level at the Commission, Isabel de la Mata, to present and have a dialogue, to introduce and have a dialogue with Anna, who is a well-recognized journalist in the European international field. We will talk about the cooperation funds, the Next Generation Funds, which has been approved by the Council of Ministers of the EU. And today, we have already presented to the Commission a holistic package of measures in order to get the reduction by 55% of the CO2 emissions from now till 2030, and also the climate neutrality of the European continent by 2050. This is one of the initiatives, or one of the projects that's most ambitious launched by the Commission in a long time. In the past, I was in charge of the European Energy Union, and we already thought that was ambitious enough, but this has really made a quantum leap forward in terms of ambition. And so we will approach it all together. And we have here some world experts. Soc de la Torre from our Climate Directorate General to talk about this and to have a dialogue with you. So I wish you a very, very good and fruitful summer course. As I've already said, I'm convinced that there will be many more summer courses in the future altogether. And next, if I'm not wrong, we will listen to the European Commissioner, Stella Kyriakides.
Hello, everyone. Let me start by congratulating you for being the first people to attend this summer course on the European Union, organized by the European Commission Representation, the European Parliament Liaison Office, and the Barcelona Center for International Affairs. I hope you find it both educational and enjoyable. I also congratulate the organizers for making the course happen. Even if we cannot all be in beautiful Barcelona this year because of the pandemic. COVID-19 has turned our lives upside down. It has inflicted a heavy toll on our economies and societies. It has taught us some harsh lessons, which we will act upon. But it has also reminded us that the European Union is strongest when united behind the common cause. As soon as the pandemic hit, the European Union and its member states took decisive, coordinated action. Our emergency support instruments sent staff and equipment where they were most needed, in a powerful display of solidarity. Since then, that solidarity has underpinned all our efforts to fight the pandemic, including our successful vaccination strategy, giving all member states, big and small, equal access to safe, effective, and affordable vaccines. The same solidarity has inspired our global leadership. We launched the coronavirus global response, and we are the largest contributor to the COVAX Global Vaccine Sharing Facility. This unshakable solidarity will also lead us out of this crisis. We have an opportunity to create a healthier, more resilient future. Europeans understand this. It is why they support more Europe and more health cooperation. We will continue fighting this pandemic and building resilient, interconnected health systems capable of responding to any future health crisis. Friends, in May 1950, Robert Schuman outlined his vision of a Europe built through concrete achievements, a robust, people-centered European health union, delivering lasting, tangible benefits and leaving no one behind, will be one such achievement, and one that we can be proud of, one that shows Europe at its very best, united and strong. Thank you.
Moltes gràcies. Començarem ja doncs amb els continguts.
Thank you very much indeed. So we will now start with the contents of the course. So I'm going to ask the people who are part of the first roundtable discussion to come here, please. And we will go downstairs. Thank you all. And we will actually start with the course.
Bona tarda.
Well, good afternoon. So we shall now continue with this hybrid session from a technological point of view and from a linguistic point of view. I'm going to start when I have access to listening and to seeing the person with whom I need to talk to. But for the time being, we do not have any signal. I'm here. Oh, you are here. Oh, excellent. Sorry about that. Good afternoon. Well, so let's now go to Spanish. Good afternoon, Isabel de la Mata, the main advisor on health and crisis management at the European Commission. She was the main advisor in terms of health. And to sum it up, she has a long-standing experience, both in terms of health and in terms of public management at the EU, and also here in Spain, in the Basque Country. And last but not least, she's a physician, she's a doctor. It's not bad to have a person with health responsibilities with in-depth knowledge about medicine. So, whenever you want, Isabel, you have the floor. Go ahead. Thank you very much indeed. Thank you. Good afternoon, everybody. I am sorry I'm not able to be with you in Barcelona in person to discuss personally about the challenges that the European Union is facing. And I'm being told that I cannot share my presentation because the technical means do not allow me to. So either you allow me to do it or I won't be able to share my screen. Is it possible for me to share my screen and show you my PowerPoint presentation? Well, in the meantime, whilst this technical problem is solved, what I wanted to start by doing is to say that in the introduction it was said that the EU does not have health competencies. That is not true. The EU does have health competencies. It does not have actually competencies in the management of health services, but in we have competencies with regards to drugs, thanks to which we've been able to approve the vaccines that are being used for European citizens.
Temporalmente la autorización de puesta en el mercado, cualquier medicamento.
And any medicine, the European Union has competencies in the quality and security in terms of blood, tissues and organs, and also in tobacco. And there is a decision by the Commission with regards to health threats at the border, boundaries, and there is a Commission directive about that. And with regards to health services, the access of patients to health services in other countries. And thank you. Now I will be able to share my screen. Wonderful. And it also has competencies, thanks. No, it doesn't allow me to. It has competencies with regards to health services, following the reforms that the different countries are undergoing. I do not know why I can't share my screen. Do you see my presentation? Please, could anybody tell me if you can see my presentation? Because I'm not sure about that. Sorry, Isabel. Yes, indeed. We can see the response of the EU to the COVID-19 and other screens ready to be shown. Okay, perfect. Thank you very much indeed. So, it's going to be an initial presentation about the fact that there are competencies. But it is true that we spend half of our time talking about subsidiarity and about this is mine, this is yours, referring to the national or the European Union competencies, especially with regards to the health system. Fine. Okay, let me introduce what has been the response in front of the COVID-19 challenge. These are the results of the FDTP, which is our agency, the ECDC, the European Center for the Detection and Control of Illnesses. The data, the global data, and the European data, just to show the situation in Spain, Portugal, and Cyprus. It is also true that some of the indicators need to be revisited.
Recording in progress.
Because the incident we have now is not the same one we had a few months ago. It's not the same type, it's not the same people or the same type of patient. Currently, the COVID is occurring amongst the youngest. And we're wondering whether the indicators that we used so far, i.e., based on notice, would change the percentage of positive people in the samples, thanks to the tests we carry out, whether this is enough or whether we should also bear in mind that these data are already taken into account, but not when we analyze the occupation of hospital beds, which is very important. There are less hospital beds occupied for the level of contagion we have. So these are the data that we have on a weekly basis at the ECDC, and this is what determines our response. The response to COVID has tried to cover different goals. First, to have a common answer, a common coordination. In January and February last year, and in March, when the pandemic was declared by the World Health Organization, there was a certain lack of coordination, given that it was a response of health systems. But there was a coordination from the very start, in the sense that there was a declaration of the cases that were occurring. At the ECDC, we have an alert system and a response system. In the coordination through the Health Security Committee. And immediately, the Council set up a group for political response, where the different actions in different fields were defined, especially in the health field, but not only the health field. Some things overlap, and it would be difficult to define what type of response is, but whether we close or open our borders, or whether we allow the passage of transport, this is not purely health. So, a common response to mitigate the socio-economic impact of COVID-19. It has not been just a health issue. It is for the first time that a health crisis becomes a global crisis. We also needed to reinforce our public health systems and our healthcare systems because some of them collapsed. In hospitals, primary care, or outpatient units in some countries, there was the reference of health professionals in some countries. And to give member states, to give support to member states in the coordination of the national responses, and to give, especially with regards to the personal action. It is here that we realized that a lot of the production of masks had been externalized, had been outsourced to China, or for example, the production of drugs like paracetamol needed some support. We needed to give support to the member states and give objective information about the virus's dissemination. And the response occurred in all fields. Giving support to research at the time, there was no research, there was nothing. No vaccines, all the way to the repatriation of citizens to give them support in different areas. We needed supporting research on vaccines, diagnostics, treatment, repatriation of EU citizens, providing funding through the Coronavirus Response Initiative, liquidity through the European Investment Fund, putting in place the most flexible state aid rules ever in the EU to save jobs and companies, and helping ensure supply of medical equipment, increase production in EU, and joint procurement, issuing guidelines on measures to stop the spread of the virus, on testing protection, ensuring the flow of goods and workers' mobility in the EU single market. The response has been global. It is not only a health crisis, it's a global crisis. Now, from a health point of view, we have used two main instruments, two specific instruments. The first one is the RESC-EU, an EU civil protection mechanism. And I apologize for the slide because you're mixed in Spanish and in English. But well, due to the lack of time, I didn't have time to translate them all into Spanish. Sorry about that. As I was saying, we have two main instruments to respond to the health side of the crisis. The first one is the EU Civil Protection Mechanism, RESC-EU, where we show the need to send some countries. So far, it was only used, it's a mechanism used for floods and fires and other types of crises. And this instrument has been used in 2020. We have two main mechanisms. First, the stockpiling of medical equipment with different countries, which is here permanently, and whenever we need them, they go to another country. And the second mechanism is direct solidarity. One country, Italy, for example, we need masks, we need ventilators, we need ambulances, and the other countries respond. I have masks, I have ventilators, I have breathers. And the EU Commission is the one that centralizes it all and takes care of the transport. And the second instrument is the emergency support instrument that the ESI created in 2016 at the time of the migrants crisis, which ended. It has been re-edited last year in April 2020 with an initial budget of 2.7 billion euro, and it also uses as a basis the Treaty on Solidarity. So this instrument has been used in the EU member countries, 27 at the time, 28, well, till the end of last year. Now, this instrument, this emergency support instrument, is what has allowed us to purchase the vaccines, to buy the masks and other items, and to give support and aid for transportation. Now, the health response has covered different areas. The first one, the one that has been more publicized, are the vaccines. Vaccines, at the beginning, we immediately saw typical illnesses like ESTA. And they are very difficult to respond because antivirals are very scarce. The ones that work in general with illnesses are retrovirals in the case of HIV/AIDS, but it's something that basically does not exist. So this is a virus, and we needed to respond with antivirus, or mechanisms that do not kill the virus, but at least kill the consequences that the virus produces. And that was the way we approached the problem. We needed to develop vaccines because it was the only way out of the crisis. And for that, we needed to invest in research, and we needed to purchase these doses. I'm going to go back and forth with the slides in order to have them as a basis of the different types of responses the EU has provided. From the very onset, our president knew that we had to move through this point. And at first, when the countries that wanted to move on their own, and as you will remember, there was an initial movement of 4 countries to purchase on their own vaccines, we reverted that thanks to the different council meetings, and what they had started became something that encompassed the 27 member states instead of just 4. And then we started our vaccination strategy. We launched it in June last year with the communication of the vaccination strategy, and then it followed up with the final strategy. At the moment, ever since vaccination started at the beginning of the year, these are the figures we have achieved. 65% have had one dose, one uptake in adults aged more than 18. And at the beginning, vaccines were just for adults. It's not that they were not safe for children, but pediatric drugs applied to people younger than 18, they follow a different pathway. There is a different legislation about pediatric drugs, and they have to be approved specifically for them. And that, there had been no clinical trials for children. And now the situation has changed. And it will also change the way in which we approach vaccination, because now it is being applied to teenagers in some countries. At any rate, the EU focused on vaccinating, above all, people aged more than 80 and health professionals by defining 3 strategies. To have half of the population vaccinated before the summer, and also professional health workers. And we have made headway in all of the groups. Here we see the differences by age group. The youngest, aged below 24, were still at very low levels because it was started recently, and because of the vaccination strategy that was defined in November last year, established as priority groups elderly people, people living in old people's homes, followed by health professionals, and then a number of individual characteristics. Given that there would be, to start, there was no vaccine for everybody to start, and secondly, we could not vaccinate everybody at the same time. So we needed to prioritize. There is a system to monitor the vaccination in the Illnesses Control Center, the Disease Control Center, which is the one that shows us the global situation, the situation country by country. And for health professionals, now we have 83.2% of a cumulative uptake of at least 1 dose, amongst health community workers and cumulative uptake of full vaccination among HCWs of 73.9%, based on a median from 17 reporting countries. Probably this will be increasing. Somehow, it makes sense, because professional health workers are the ones who need to see vulnerable people, patients who also suffer from other illnesses, and this is also a national competency, given that it belongs to the national health system. And this is a situation for people aged more than 80 years old. We have reached almost, 80.8% of a cumulative uptake of at least one dose amongst adults aged more than 80. What we have are differences between countries. Some people are more reticent, and others have achieved lower percentages of uptake. Let me go backwards now, as I've told you I would do. Okay, so this with regards to the secure and effective vaccination. 4,400 million doses. Why so many? This is an anticipated purchase. We still do not have them. We have reached agreements with 6 companies, 6 vaccines. For the time being, we only have 4 approved provisionally for their introduction into the market. First, when the purchase agreements were reached, we did not know which vaccines would be successful, the ones that would actually have a successful outcome or not. We also needed to diversify. There are different types of vaccines. We have the ones with attenuated viruses and the ones based on RNA. And in the same way, the same way we get vaccinated from polio and others. And then we have the new technologies, which are the ones based on messenger RNA or proteins. We didn't know their efficacy, and yet they have been the first one to be approved. The one based on protein is still a bit delayed. Secondly, we needed to buy just in case we didn't know. I mean, it was not really a purchase. We needed to know that we would have that available. Secondly, we had to have vaccines to donate. Even though the EU works at, has adhered to COVAX, we are also making individual donations. Donations, when I say individual, I mean country by country, and also globally. Donations in terms of money and in terms of vaccines. We needed to have enough doses for that as well. Treatment. The treatment, as I've said already, it is a bit more complicated. We have developed a therapeutic strategy, a therapeutic vaccination strategy recently. So far, there is just one drug that has been authorized as a treatment for COVID-19, one that has been presented for evaluation, and one that are under the rolling review, which is a quick review before they are officially presented for validation. It is a provisional authorization. And the others are monoclonal antibodies. Now, another strategy that has also been used from the very onset is the plasma of recovered patients. Here we have made an effort funded with an instrument for emergency support, just like the vaccines, by the way, which is part of it, in order to have more units of plasma donations. Countries have a lot of blood banks, full blood banks, but they have less stockpiles of plasma. And we have decided to give them support in terms of plasma donation and also the use of what plasma contains, which in this case, what we have are antibodies. and all of them from patients that have already recovered from COVID, that can be used directly or for the development of these drugs. Now, the tests. Tests at the EU and the Commission, we have developed strategies about how the tests would be carried out. Strategies for the development of tests, the apps for the tracing back of contacts and alerts from one country to the next. A single app could be successful if it feeds, if data are included in it, if it's used. If citizens do not use it, it is useless, both for the tracing back of contacts and alerts. We have published guidelines about self-tests, validations, genomic sequencing, RATs, etc. We have also produced a purchase through the instrument of emergency support for quick tests, which have been distributed and are still being distributed to all member states. Right now, we're also devoting some aid, country by country, in order to increase the number of tests, both quick tests and PCRs. In this case, to obtain the digital certificate that allows citizens to travel. We have also signed agreements with the Red Cross for the development to carry out tests in more vulnerable populations or populations that are less accessible in 7 countries, one of which is Spain. In Spain, the communities are Catalonia, Madrid, and Castile and Leon. Then we have also carried out other types of activities with the emergency support mechanism, like the training of professional health workers, professionals who are neither physicians nor nurses. They would work in intensive care unit, but they could work in it. We have trained 17,000 of them, nurses, in different hospitals. In Spain, the impact has been very high, indeed. I know the number of health professionals who have been trained is very high. Not in relative terms per inhabitant, but yes, in global terms. Well, the response to protect health, a number of activities have been carried out, like the European Union for Health, the pharmaceutical strategy, the EU for Health, and HERA. You know, the support to the health emergencies, which is what we have now. And it was said it would be started next year. And basically, in order to detect the variants, this variant detection in the different member states, and also to give support to health systems through transport cooperation, robots, material distribution, and we have also purchased robots for disinfection. Guiding and supporting member states. We have published guidelines to member states on managing different areas, going from health-related border management issues, or, for example, for vaccination strategies, the response of national systems. We have a commission that has been meeting twice a week for the coordination of all countries. And we invite the World Health Organization and neighboring countries in an extraordinary way whilst this situation lasts. Joint procurement agreements. This is the difference with emergency situation mechanism is based on the fact that here each member state pays for itself to ensure the availability of supplies and equipment, and, for example, buying the needles needed for the vaccines. And these are things that have been actually bought. Gloves and coveralls, different elements that are still needed. All of the things that a single country by itself could not purchase. And by making a global purchase altogether would ensure availability for everybody. And some countries limited the export of these products. Another instrument was the so-called clearinghouse, which was a way of getting in touch with the companies, the producing companies. I have this, I need that, let's agree and do it faster. Or this is not necessary and you can discontinue it. Some comments about the European Union for Health. The discourse or the speech on the State of the Nation. President Ursula von der Leyen made a reference to it. To me, it is more than obvious. We need to build up a European Union for health that's stronger. We need to reinforce our preparation and crisis management for transborder health threats. This sounds new, but it's not new. But it is, when I heard for the first time the European Union for Health was back in 2000, when the Spanish presidency for the EU was getting ready. Because at the time we were discussing about patients. And right now, well, we're talking about transborder health care, but it has not been implemented till now. Another leap forward has been the conference about the future of Europe, which I believe is the topic you'll be discussing tomorrow. There are 10 topics, one of which is health, and also the 4 citizen panels about climate change and the environment. It is important, as we have seen, citizens are concerned about health and the impact COVID-19 has on their daily lives and the security for everybody. The European Union for Health basically implies what do we need and what shall we propose. Okay, what do we need? We need to be able to intervene better and faster as an EU, to have more and better data, to be able to control the tests better testing and contact tracing, to be more prepared, to have better preparedness planning at all levels, and to ensure supplies of medicines and protective equipment. This is what we have tried to cover, and we suggest different solutions for that through 3 main mechanisms. Through communication, which implies explaining all of these, and then regulation proposals. In the case of these serious cross-border threats to health, we have gone from the past legislation to rule, from the lowest scale to the highest level, a global extension. And the European Medicines Agency will have greater mandates, greater competencies. And also when it comes to identifying the supply lacks, to be able to act. So these are different responses. I think I'm doing well time-wise, so I'm going to dwell in this a little bit. The proposal for the rule about transborder threats for health, preparedness and response planning, epidemiological surveillance, new networks, early warning and risk assessment, and coordinated response at the EU level. Not only acting as an advisory body, but also to act in the case of DG to increase vigilance, which is already being done, to make recommendations for complex situations with guidelines and for risk populations. For example, the use of masks should be like this. We will be able to say so in the future if the proposal is successful. And to have a network of reference labs, because right now there isn't such a thing. However, there is in the case of animal health, but not in the case of human health. the case of EMA, the European Medicines Agency, to have competencies and also monitoring the safety of medicines once they are in the market, and also to deal with the deficits with regards to the supply. And finally, the EU Health Programme, which is another health instrument, a basic instrument. I'm not going to dwell in it. But the health program, just to give you an idea, this has gone from 460 million 7 years ago until 2020 to 5.1 billion for 2021. So it has been multiplied by 12 or 13. This year, given that this is the first year, it's going to be a bit more scarce. The 5.1 billion are distributed in 7 years. It is highly ambitious. It is a response to the pandemic. And basically, with this division of 20% and 12.5% in different areas, basically, it's going to be used in crisis preparedness, disease prevention, health systems, and healthcare workers. Fine. So these are the main areas. The main areas for this year's program: preparedness for the crisis and the management of transborder health threats, promotion of health and illness prevention, the reinforcement of health systems, the digital transformation of health systems with the European space for health data, and the reinforcement of a health legislation implementation. So this is all. Thank you very much indeed for your attention. And I hope my presentation has been helpful and useful. And I hope I have not used more time than had been allotted to me. I was telling you, okay, one quick question. This FPP2 mask that I bought today in a chemist here in Barcelona is made in China. Have you thought in the EU, because we all remember a year ago, it was a tragedy to be able to get gloves. Now we know the gloves are useless, and masks for almost nothing. Has the EU thought about the need to, in addition to purchasing, to manufacture those crucial elements? Yes, of course. Of course we have thought about it. And we have contacted companies. This is part of our industrial strategy to be in touch with the pharmaceutical company, and also the strategy for health workers training. There is an additional problem. As you have said, for the other side, there are health products. There is a regulation with regards to health products, and others are not. They consider them to be personal equipment because they had not been included in that area. They are not considered to be health products. Surgical masks are health products because they are used in hospitals. Gloves, there are different types of gloves. Some are surgical and others are not. This is another problem. But in terms of production, yes, we are working on it. We are potential producers to stimulate production in the EU. Well, everybody, more or less, especially amongst the in-person people attending the room who are more or less young, everybody has some relative or somebody they know in the UK, in the States, or in Israel. From the public opinion point of view, this has been very much criticized, and the perception is that whereas public opinion says, well, Joe Biden and Boris Johnson in the UK have applied America first and the UK first, and the EU has not applied that principle. What has been the vaccine distribution criteria in the EU, and why? Above all, why haven't we kept all of the vaccines we had for ourselves? Why have we been exporting vaccines when in fact we saw that in the USA, younger people than myself had already been vaccinated a month ago? Yes, here. Two different issues at stake. There is a difference between the actions undertaken by the USA and the UK. First, the approval of the vaccines. We have authorized them, and they have authorized them by an emergency authorization. And this is a conceptual difference. Emergency allocation or emergency authorization is what used to be called compassion decision. There is nothing else, and we use what we have. And given that we use what we have, if there are side effects, well, that's your problem and not mine. And, well, it is the patient's responsibility. So we had compassion-based treatments when there was nothing else in patients that were in the worst dire straits. And this, with regards to the vaccines, is very important because given that we didn't know, and in fact, the strongest discussions when we talked to the pharmaceutical companies, the liability, when something would not go well, when it's a new type of medicament, when it's a new type of medicine, but clinical tests, clinical trials are done with a specific number of patients, and then it is launched in the market. Well, it was important that there was some liability at stake. Secondly, the EU is also selfish. Exports were controlled, but we only actually detected one export that broke the rules about exports. Well, we could have said the EU first and only us. But whatever, it was considered that in this crisis, if we do not all come out of it at the same time, we would all fail. A variant appears one day in one country, and the next day, well, or 2 weeks later, it appears in another country. So it is very difficult indeed. Countries that were totally closed, like Australia or New Zealand, they have also had virus cases and of the different variants as well. It's very difficult to stop that. So we could not actually stop the export of all vaccines. But in other parts of the world, you're right, they implemented this policy in a much more strict way than us, following the rationale that until we are not all more or less protected, there is nobody fully protected. We have seen that not only the USA, there is a very strong anti-vaccines movement, and the government and different groups have to incentivize and motivate the population, even to give them for free hamburgers and extravagant things for them to get vaccinated. But this very week, the day before yesterday, the French President Macron did something similar. He was incentivizing people. Listen, if you are not vaccinated, you will not be able to go to a restaurant or to get on a train or plane. Within Europe, within our 27 member states, which are the countries that have the strongest anti-vaccine movements, who could actually jeopardize the European group's immunity? Well, the story of anti-vaccine movements is a long one. And within the EU, already 3 years ago, there was a recommendation from the Council to promote vaccination. At the time, smallpox was a main problem. And I'd like to distinguish between the different movements, the anti-vaccine movement. And there are people that, for different reasons, have doubts about the vaccine. At the time, it was measles. But there is a difference between misinformation and bad information. We tried to convince people by saying that it's the best option. But we should also think that vaccination is an individual action, but it's also an action that shows solidarity. You do it for yourself and for other people, because there are people who cannot get vaccinated because they have diseases or self-immune diseases. Now, these people get protected if others are protected. Children at the time. Young children or very, very small children are not yet being vaccinated. And if other people are not vaccinated, they may end up being affected. So it's an act of solidarity. And to a certain extent, it's rational. If there is a lot of people who is vaccinated, a lot of people who are vaccinated, and you get to a place where there are people who are vaccinated, protection is never 100%. It can be 98% or even 90% in some cases. Some people who only have one dose, so their protection is lower until they get the second dose. So people get into risk situations voluntarily. One thing is that you have not yet reached your second dose. Another thing is that you do not want to be vaccinated willfully. I mean, for example, health professionals, it's a category of people, and other people who are in touch with people affected with COVID-19. With regards to the countries, the Commission has published in the Eurobarometer. France is one of the countries with the greatest reticence to vaccination. That's why Mr. Macron has actually undertaken a number of measures. Other countries as well. The latest Eurobarometer was published in May with regards to COVID vaccination, and you can reach it easily. What we need to try and do is to avoid that this happens and to convince people that they have to show solidarity and to convince the population that the best way to fight against COVID is through vaccination. Okay, we have 20 minutes. Let's now we'll give the floor to the audience, those who are following us in person and virtually. So let's start with the people in person in the room. Any hands raised? Anybody has a question, please? For Isabel de la Mata. Please identify yourself, and please, it should be a question, not a speech, and it should be very brief. My name is Ada. I study law at the Pompeu Fabra University, and I have the following question. A few days ago, we knew that the Spanish vaccination has almost been developed, and we will soon be able to have it in our hands. How could this change of the vaccination landscape in Europe? Could each country generate its own vaccine, and then this international cooperation scenario would not be possible? Thank you. No. For different reasons. Vaccines, any new regulation with new technologies is approved by the European Medicines Agency. It is the only way that this drug is accessible to all European member states through the EMA. So if there is a national approval, a purely national approval, which is quite rare, in the case of the COVID-19 vaccine, because these are very new technologies, it's not a generic drug. It would be very rare. But if there was a national approval for whatever reason, it could only be used in Spain. And I don't think that will be the case, because it would not be profitable neither for the person, for the company developing the vaccine, nor for the country. Because, for example, in the European digital certificate, only vaccines approved by EMA or by the World Health Organization are accepted. The 4 accepted by EMA and the ones accepted by the WHO. And in this case, the person who would be vaccinated by a Spanish-only vaccine would not have access to European digital certificate. I believe that the Spanish vaccine will be approved by the EMA. It will be approved by the EMA for its launch into the market. And it is a good piece of news. We need more vaccines. We need new vaccines because different strains are developed, different variants are stemming up, and we still do not know it. But probably we will have to spend some time with different vaccine boosters, like, the flu vaccine. Every 3 years, every 2 years, we still do not know. And for that, we do need vaccines. So it's wonderful that these people keep on working and developing new vaccines. So next question, please, from somebody who is following this dialogue, this conversation through the internet. Pedro Gallego Mirio asks, which legal measures will the European Union undertake against AstraZeneca for not complying with the contract? The measures have already been undertaken. 2 complaints have been presented in Belgian courts because they are the ones who are competent for the contract that was signed. And in September, well, there has already been a provisional ruling giving the option to the company to supply a number of vaccines, or if not, with a financial penalty. So we will have to wait until September to find out what the final measure is. Any other questions here in the room? Please identify yourself and ask the question directly. My name is Imma Lopez, and I'm a political sciences student at the University of Barcelona. In the case the group immunity risk actually was raised, do we have the possibility of raising a complaint as the European Union legislation gives us the right to? Well, the free movement of people also has a mechanism to be suspended for different crises. In other words, or to block it for a few months. For a few months, for example, you could not leave your member state. Now, the free movement of people is not an absolute right. It is nuanced by different issues, and one of it is public security. It is in writing, and member states want to protect themselves. They need to communicate it, of course. They need to argue the need to impose extraordinary measures in order to assess whether this is applicable or not, or whether the risk and the measure are well balanced out or not. But the fact that new borders were set up during the migrant crisis by different member states, and then they have applied what would be the equivalent of the Spanish law, the organic law on special measures in terms of public health, which more or less exist in all countries. And these issues have always been discussed, first at the ICPR, at the IPCR, the mechanism used by the Council. During the last meeting on Thursday, now fortunately we only meet on Mondays. So another question, another online question. Gemma Garcia asks, citizens at large need all of the information, the one that you have given, but they believe that the EU has managed badly the COVID-19 crisis. How could we change that public opinion? Well, that actually, you could write a PhD dissertation about that. Well, this is one of our communication problems,
También por esto la conferencia El Futuro.
how we communicate with citizens. That's why we have the representatives of our institutions in the different countries. We try to update our webpage. I mean, all of the things I've told you, all of the slides I've showed you, I mean, there isn't a single one that has not been taken from our webpage, from the Commission's webpage, from the Parliament's website, from the different European Union institutions' website. It is public and published, but we have to make an effort. We're well aware that we need to communicate better, and we need to use more updated and modern mechanisms like social media in order to disseminate our policies and our actions, and not only bad news. Sometimes there are failures, and that's what is disseminated. But we could communicate better that all countries have been served the vaccines they needed, and the donations we have been making, all of the coordination hurdles that have been overcome, how we have been able to create corridors so that the supplies kept on coming, and to link up with the tourists that were in a bad country or in a country that was having a bad time due to the lack of ventilators or masks. We have been there to give them support and to help them. Our professionals, our health professionals, we have sent, for example, medical equipment to Italy at the beginning. And many European hospitals actually got Italian patients thanks to our coordination. We need to communicate better, full stop. Another question here from the room, from the hall. My name is Paul. I study political philosophy at the Pompeu Fabra University. I'm the general coordinator of the Utopius think tank. I'm interested about the discussion on the vaccines patents and what has been the positioning of the EU after Biden's administration announced its will to go over that, and the evolution of that positioning in the last few months. Thank you. Well, there has been an evolution in that field, and we're still evolving, or we're still thinking. Basically, the problem is not the patents, but the production. On the one hand, we have the rights of those who have produced a vaccine, those who have produced anything, an article, a book, or anything, to defend the intellectual property they have on that, their property rights, their copyright. And the problem is that we suppress patents, we suppress intellectual property or copyright. Nobody will develop anything else in the future, because that expectation of having gains on what I have invented or with that patent is eliminated. On the other hand, it is true that vaccines are not a book, they are something else. And we find ourselves in a world pandemic situation. But if we only suppressed the patent and we said, okay, here's the patent, and now do whatever you want with it, what we need to know is understand what the technology is all about and to have the machinery to produce with that technology that vaccine. So what we need to increase is the access to that technology in production sites. But we also need that prices be adequate for the payment capacity. I mean, what's not acceptable is that the price paid by Germany is equal to the price paid by Bangladesh for the same drug produced, maybe to pay for the same vaccine. And what we need to do is to work on that front, on the price front, and on the technology access and production access front, rather than the total liberalization of patents, which is much more complicated, and it implies many problems. And it will not be useful. I mean, just suppressing patents will not solve the problem. It will not be helpful. Another question through the web.
irregular migrants?
Bueno, lo mismo de siempre,
Same answer. The organization and funding of national health system is a competency of national member states. But of course, everybody should have access to the vaccine, even if it's only for a selfish reason. If everybody is not vaccinated, we will not come out of this problem. Everybody needs to be vaccinated because that's the only way out. It's the only way to get a group immunity level. And primary prevention is basic. And for that, we need to have a universal access to the vaccination. There is no European regulation about the access to health services of irregular migrants, because there is no legislation about that. But we have always advocated for the access to preventive medicine and more, of course, but in this case, above all, to vaccines through the public health system of everybody living in the EU, whether regular or irregular. Another question here from the room. Right. Good afternoon. My name is Silvio Marquez, and I study politics and law at the Pompeu Fabra University. You have talked about something in your presentation. Should we have prioritized before the European vaccination strategy the group of young people? We have seen what has happened in Spain. At the end of the academic year, at the beginning of the summer holidays, and the reopening of discos, I mean, look at what has happened. So the group of young people shouldn't it also have been vaccinated together with health professionals and elderly people? The answer is no, because the vaccination strategy was composed of 3 layers. First, we should not let people die. Secondly, the second priority is that hospitals be not collapsed. And thirdly, we need to vaccinate everybody. Young people do not die. Those who die are the elderly. Young people do not collapse the health system. Of course, there are young people who have to go to the intensive care unit, but not most of them. So young people actually distort the figures, but those who die are the elderly people, and those who needed to be vaccinated from the very onset were the elderly people. That's why we prioritized elderly people, especially those living in old people's homes. Now, health professionals were a priority as well, because they have a larger possibility, a larger likelihood of being infected, because they're in touch with the people, the patients affected by COVID. And whilst they have the symptoms, they are transmitting it to other patients who are in touch with them in hospitals or elsewhere. So we decided to follow this strategy, as was done by the WHO as well, by defining age groups. They go from 80 to 30 and then below. So the main priority was that patients did not die, that the hospitals were not collapsed, and thirdly, to suppress or eliminate the virus. With regards to young people, I understand young people are sick and tired of so many restrictions and so many lockdowns and isolation strategies. But of course, when a large part of the population is already vaccinated, then those who are affected by the virus are the ones who are not vaccinated, in this case, young people. Well, I mean, the age-based strategy was a good one, in my opinion. Then, I mean, different professional groups were taken into account. But, I mean, the WHO said so recently, and we all agree on that notion. We have just 3 minutes left for one last burning question online. Alex Goddess asks, what explains the failure of the solidarity plan with third world countries and whether the EU is responsible for that in part or not. Well, it is, I won't call it a failure. Let's see. We have the COVAX mechanism, which is the one that's being developed with UNICEF and other international mechanisms. We participate in that. And basically, we give money and we donate vaccines and then individual donations to third world countries. We also have to bear in mind that the pandemic is actually going through geographic areas. The poorest countries have been more affected later. And that was rational. It was only logic that people were being vaccinated where the situation was worse. Certain African countries, I mean, it didn't make sense to vaccinate there when here we were still in the midst of the crisis. But we actually, the EU is the main contributor to COVAX, and thus it shows its solidarity, both in terms of vaccines and in terms of money transferred. And we're in touch with the COVAX managers, and we participate proactively in the discussions with them. On the other hand, it would be unreal to say, okay, let's all get united for the world, and let's, speed up to 30%. I mean, well, that would be unrealistic. We have done the best we could. Isabel de la Mata, on my side, thank you ever so much. Thank you for being so clear, for being so straightforward, and for having this wonderful capacity to synthesize complex problems as you have. Thank you for your presentation. And we have just 1 minute left, and I'd like to give the floor to our host, the director of the CDOP think tank, Mr. Paul Morillas. On my side, thank you very much. Indeed, Isabel, it has been a great pleasure to listen to you. On behalf of the organizers, thank you so much, Isabel. On behalf of CDOP, the European Parliament, and the European Commission's office in Barcelona, thank you, Isabel de la Mata. So this is the end of the first part of the first day. Now we have a 15-minute coffee break before the second round. So if you're patient enough, we will show the video we couldn't show at the beginning. Then we'll have 15 minutes, a 15-minute break, and then we will resume promptly at 17:45. At 5:45 p.m. on the dot, we shall resume. Thank you.
We'll
continue with the session, as the program states, moving on to the roundtable. In keeping with the response from the EU institutions to the pandemic. And we'll be moving on to different matters. We were focused earlier, especially on purely medical affair, vaccines, medical material, and coordination between different countries. And now we'll be moving on to different aspects. On this roundtable, we'll have in this order, Alessandro D'Alfonso, who is, of our three speakers, is the only one who isn't here physically, but I believe he's listening to us. Alessandro D'Alfonso. There he is. Then there's Karma Coromina, Rafael Vila San Juan. And basically, we'll have 10 minutes of exposition by each of our speakers, and then a dialogue among the three of them. And later on, we'll open up the floor to the questions from the audience, both physically as well as online. So we're starting with Alessandro D'Alfonso. Good afternoon or good evening. He's the speaker who will be talking to us about the economic response by the European Union to the economic crisis, as Isabel de la Mata was saying earlier, which the health crisis brought about, which is also a very current theme, because Paul Morillas and Sergi Barrera was saying earlier, the first of the 12 special budgets has just been approved from the special funds from the European Union, which set in motion a brand new funding procedure and dealing procedure, as Alessandro D'Alfonso will be telling us about. He's the analyst of the European Parliament Research Service. This is specialized in budgetary issues. And on the website, we've said it already a few times, the European Union and European Parliament website, there's a lot of papers, reports, and analysis authored by Alessandro D'Alfonso, and it's as easy as just going to the website. He's also taught in many European, Italian universities. The floor is yours, Alfonso.
Many thanks, Anna.
Mi scuso.
No problem at all. Many thanks and good afternoon to everybody. I'm sorry I'm the only one who is not able to be with you in your beautiful city, but possibly another time. I would like to make a few points on the response of the European Union to the socio-economic impact of the crisis, because we have heard from Isabel that the health crisis has soon become also a socio-economic crisis, requiring many measures. And the EU and its member states have taken decisive measures in this respect. I would identify two sets of measures. First, there are measures to mitigate the impact of the crisis, and then another set of measures to revitalize our economies and also to address some pressing challenges that we have. As far as the mitigating measures are concerned, of course, we all think of the key role that the European Central Bank has played and is playing, for instance, with its pandemic emergency bond purchase program. And at the very start of the crisis, the EU and its member states have also suspended the borrowing limits under the Stability and Growth Pact, thus giving room for maneuver to national budgets. However, the EU has not shied away from creating also common instruments to respond to this unprecedented crisis. There were in particular three safety nets, one for workers, one for companies, and one for member states. And I would like to single out the one for workers, the SURE program that we have seen also in one of the slides that Isabel presented. This program, SURE, helps member states support jobs and workers' income across the Union. It is endowed with 100 billion euros, and it has been extensively used. By the beginning of this summer, 30 million workers across the European Union had benefited from this program, as well as 2.5 million companies. So it is a program with an impact for sure. And SURE has financed the National Employment Support Scheme, social security contribution of people working in severely affected sectors such as the tourism sector, for instance, and also health benefits for workers that were absent due to the coronavirus crisis. According to the president of the Spanish Retail Association, I have read that SURE was a blessing, and he said that 40% of bars and restaurants in Spain would have disappeared without the support of these loans. So these are figures that I found quite striking. But of course, we have said there are mitigating measures, but at the same time, we need also to rebound. And to this effect as well, there are some breakthroughs in EU finances. In particular, as we all know, there is the new Next Generation EU recovery instrument that was agreed by all member states last year. The EU budget normally is not seen as an instrument that is able to respond to major macroeconomic crisis. Because of its limited size, it is just around 1% of the EU gross national income, which is very far away from the size of federal budgets, even in decentralized federal entities. And on top of that, the EU budget is also linked to a multi-annual planning system, which is called the multi-annual financial framework. And this is good on the one end because it gives predictability of investment. On the other hand, it gives some rigidities to the system. So in principle, if we have a crisis, we need to invest more. But if we have set a 7-year budget many years ago, we could not predict that there would be a crisis. And so this function of macroeconomic stabilization was by and large missing in the EU budget, and this is not this is no more the case now with Next Generation EU, because last year the EU and its member states agreed on the largest ever investment package of the European Union. It is worth 2 trillion euros over the next 7 years. And it includes the traditional long-term budget of the EU and Next Generation EU, the new recovery instrument. And the recovery instrument is 40% of this total amount that I've mentioned. So it is a massive instrument. And another important feature in the new recovery instrument is that of course, we have the issue of recovery and the challenge of recovery, but at the same time, we have other pressing challenges, such as the green transition, the digital transformation. And so the idea was to link the recovery fund with these other challenges in order for our economies not only to rebound, but also to be stronger than they were at the beginning of the crisis, meaning that these funds should help our economies become greener, more digital, more resilient, and also more inclusive, since we see that there are growing divides also in our societies. So there are many new elements that are of interest in this new Next Generation EU fund. Another one, so another exception when we compare with the past, is the fact that this fund will be financed through borrowing operations by the European Commission. The EU budget normally has to follow the principle of equilibrium, which means that revenue must equal expenditure. But for Next Generation EU, the Commission has already started borrowing money on capital markets to finance the recovery. And this is also something new and important, which breaks a bit with the past. Another element which is of interest is the fact that the Next Generation EU recovery instrument is linked to the EU budget. It's a much stronger link as compared to instruments that were developed in the past to address previous crises that were created at intergovernmental level. The European Parliament had an issue with this because if we are a union, we need also common instruments. And sometimes Parliament criticized intergovernmental instruments from the past because of their lack of transparency. The link of Next Generation EU with the EU budget should ensure also greater transparency on how these funds are used, because the next challenge is, of course, implementation. Adding the recovery instrument is a bit like adding 5 annual budgets to the normal amount of resources that were channeled. So this is massive. And when we remember that in some countries there is also a problem of absorption of the normal resources from the EU budget, we see that this is clearly a challenge that should be addressed. Finally, as I mentioned, the recovery instrument is geared also to address the challenges of our times, such as the green transition, the digital transformation. We have identified common challenges to which investments and reforms should respond. At the same time, there are national plans because, of course, the starting point is different from one country to the other. And so solutions are also tailor-made at national level to address these common challenges. And with this, I hope I have not used too much time, and I thank you very much for your attention.
Grazie tante. Thank you very much. Moltes gràcies.
Moltes gràcies. Thank you, Alessandro D'Alfonso. You went over time, but just by a tiny little bit. Rafa Vila San Juan, a very long time ago, in a very long life ago, was a very bad person. He used to be a journalist, but same as the virus do, he changed, he mutated, and now has become a very much more respectable kind of person. And above all, he's someone with a very long trajectory on what we could call looking at the world with a wide lens. He has a lot of experience in international cooperation, in managing and conflict analysis. For 2 years, he was the beating heart behind Doctors Without Borders. And for the past 10 years, he's been the project manager, the analysis director of the Institute of Global Health, IS Global in Barcelona. So he is used to looking at things that have to do with health through a wide-angle lens. Rafa, take it away. Yes, Anna, and we've worked together, but I never gave up my journalist career. And I thought Karma would go first because we thought we were going to do the politically correct thing of having ladies go first. Well, I just thought we're just moving from something very specific, such as the European Union budget. And now we can move on to the global implications of these policies, which is something that came up earlier. And I'm just saying, because it came up not just in Isabel de la Mata's exhibition, but also in the questions from the floor. The cooperation policy from the European Union, which has not applied, such as the US or the United Kingdom, it has not applied this EU first policy. And I'm sure it wasn't enough, but they did. Okay, then. Well, I'm going to start by seeing how the European Union acted for the first time. So I would say it acted like a nation. Same as the vaccine. We find ourselves before an unprecedented situation. I had never seen this in all my career. No one was ready for this. No one had anticipated or thought that things would go down the way they did. I think there were several questions surrounding the vaccine, but I would summarize things in three. So the first one is, how has the European Union faced the solution to the pandemic from the public health point of view? How did it consider its role and what it had to do? The second one, what was the strategy? What did the EU do that it hadn't done before? And the third one, what are the consequences of that? It is quite clear that what the pandemic has left us somehow is it has completely left us off rails. Countries both from the north and the south, we somehow had this border that it was telling us that infectious diseases only hit in one side of the world. There was a very clear border behind which diseases run rampant, whereas we, on the other side of that border, were quite safe. But that illusion shattered. So we finally, the disease, an infectious disease. So the vaccine was the only possible solution. And from there, we start a race to see who gets that vaccine. The race starts with the development of the vaccine. A year ago, we did not have a vaccine. A year ago, we did not have a vaccine. For the first time in history, we've had a vaccine developed in 333 days. So from the moment when the virus's DNA is sequenced to the moment when the vaccine is injected into an old lady in Coventry, only 333 days went by. And the earliest, quickest vaccine to develop was Ebola, which took 5 years. Just to give you an idea, the IS Global, the malaria vaccine we developed took 25 years, and it's still not at the clinical trial stage, but at the pilot level, just to see how it affects the body. So how did Europe become? It behaved like a nation, both inward and outward. So the first thing they did was, well, we need to buy. We need to purchase, and we need to bet on purchasing jointly for a lot of reasons, most of them pragmatic. Obviously, maybe a citizen in Romania doesn't have the vaccine, but one in Germany does, or a citizen of Catalonia doesn't have the vaccine, but a citizen of France, it does, just to put it in the more common terms, keeping in mind the borders, because in that case, the European Union needs to shut down, because the European Union cannot function if everyone doesn't have a vaccine. So at first, that's the idea, maybe on the one hand, Ursula von der Leyen, and that countries start seeing as a possibility that materializes at a critical point. And maybe you don't remember, but there is a vaccine which hasn't come out yet, the Vacunevac from Germany, which the Trump administration offered them every possible ease to leave Germany and go develop the vaccine in the US. And so that's when we said, look, there's people who are already in the race and we haven't joined yet. So Europe started building a strategy saying, well, look. No, Mr. Vacunevac, we'll purchase your vaccines. We'll give you an advance on the money so this doesn't leave Germany where it's happening. So what did Europe do? Basically, they pre-ordered, they pre-purchased at a risk vaccines that were being developed in Europe. And this is something you need to keep in mind. When a vaccine is at the clinical trial level, which means that it's already being tried on in humans, not in mice. There's phase 1, phase 2, phase 3. Phase 1 is safety, very small. It needs a large investment, but not that large. Phase 2 is not just safety, but we're also testing efficacy. How efficient is it? And in the case of COVID, we're talking thousands of people. And phase 3, which is when this is scalable, and it's clear that these thousands of people, it is efficient, but we can also make it efficient for everyone. So that's phase 3. So we have these 3 phases, and what they have is different ratios or percentages of success. So phase 1, usually 20% of vaccines come out, 80% get lost down the road. At phase 2, 30–40% go forward, the rest get off the road. And phase 3, 60–70% move on, the rest stay down the road. And now what does Europe do? Same as the US, same as the UK. It bought according to these percentages. So obviously it needs to duplicate because it's purchasing in phases 2 and 3. So they're pre-purchasing at a risk a series of vaccines that are being developed in the European Union. So obviously they bought Pfizer, which is a US company, but which was being developed in Europe. It bought AstraZeneca, Johnson & Johnson, which is Janssen, which is a Belgian company, 300 million vaccines. It bought Sanofi, which is a French company, Glaxo, 300 million vaccines. And it bought back 500 vaccines, and which is the most purchased vaccine. And out of these, only 2 came out, Pfizer and AstraZeneca. Europe had not negotiated Moderna. But the thing is, Europe had no negotiation power because it did not have the resources for that. Whereas the US and the UK were already negotiating and purchasing and investing in vaccines because they did have the resources to do so. Whereas in Europe, we had just this emergency fund of 2,700 million euro where they said, okay, we'll use that for vaccines. So this is where we start the inside battle to see what each country does. And that's when people start getting antsy because Germany, on the one hand, starts pressuring for the mRNA vaccines, which are the ones made in France, whereas France says, okay, well, this goes against Sanofi, which is the French company. So countries start to sort of go rogue. And it says, okay, well, each needs to look towards his own. And that was over in January this year with the Merkel-Macron meeting where there is an agreement is reached. Because meanwhile, Hungary has gone to the Russians to tell them they want to purchase the Sputnik vaccine. And this is where we see things starting to wobble. So this agreement for everyone to make joint purchases, which is certified with a date from June 2020, is the first agreement in Europe for the joint purchase of never before jointly bought material. Never a drug, never a vaccine had been bought beyond the will of each individual state. But, however, as I was saying, the fact that Romania and Germany get vaccinated at the same time, it is very important to keep in mind that not one country in Europe, except perhaps for Germany, I think not even France, had the ability to have that amount of vaccines at that price in this amount and in the time where it got them. Even though we may analyze the failure, which is the second part, which is the strategy, Europe did not have the resources to buy. So what it did is it created commissions. It took the trading commission and took it to DG Sante and a CEO, Sandra Galina, and she was responsible to start negotiating. The US had started negotiating 6 months earlier. The UK had started negotiating 4 months earlier. So we get in line behind a series of negotiations, which makes the vaccines come in later. So that's the first part of the antsiness between, you know, in all the member states, the 27 countries that were purchasing together. Europe was not only not ready at the level of not having mechanisms and resources, such as the US's medical research authorities to do these purchases. It wasn't ready at the bureaucracy level. Each vaccine that was approved had to undergo 27 approval trials in each member state. So these made the negotiations very long and take a long time. And because it was not ready, there was a third hurdle, which is there's an American law called PREPAC, which was signed 15 years ago, which states that contracts are confidential. And this confidentiality was imposed by the pharmaceutical industry within a European policy, which was basically based on 3 columns. So first, selection of a vaccine trial. We can see all the ones that were purchased. Second, low prices. And third, responsibility from pharmaceutical companies in case there were errors. Obviously, this third point is the one that the pharmaceutical companies do not want to comply with. And they say, no, it's states that need to fulfill this. And it's them imposing the confidentiality in contracts. And here's where the great battle begins, because what this is making things really late. The US has it done for because they have a law stating contracts may not be confidential. England follows suit, and it's already out of the European Union anyway after Brexit. And so Europe begins this back and forth to see how they can spare, how can they be spared this? The matter is that between August 2020 and December, only 3 vaccines are negotiating. AstraZeneca, number 1, Johnson & Johnson, second, and thirdly, Sanofi. Pfizer comes in later, even though the agreements with biotech were already finalized. And the thing is, none of these vaccines are first in line. Europe bet on vaccines which were not top of the line. It started negotiating with Moderna in December, nearly January, when we already had part of the population injected with other vaccines. So there was a whole strategy which has somehow attempted to change this dynamic, through which Trump, not the United States, defined that the way borders had to be closed as long as COVID was going on, especially with regards to vaccines and vaccine components, which also caused delays in the world production, especially because the first vaccine production in the world is in India. There are 8 companies in India which are making between 4,000 and 6,000 million vaccines a year, but before COVID, because when COVID hit, this production shifted and now we're missing lots of other vaccines. But the thing is, many components in this vaccine are pretty much the same. For instance, Pfizer vaccine has about 300, 200 components. Of these components, 20, 30 are subjected to patents, and US owns those patents. So for example, there are captation filters, which are something very rare, but we need them to do vaccines in Europe. So in India, but if India doesn't have them, then they can't make vaccines to their full capacity. So Europe said no. The same way we've thought of Europe as a whole, and we want Romania to get vaccinated at the same rate as Portugal. We need to do this outwardly as well. So they started a whole strategy of not closing down borders, a strategy which obviously, when people start to get nervous around January, February, you saw there was also a lock on exports, because Europe bailed on its contract with AstraZeneca. Why did it fail? Because this confidential contract stated that vaccines distributed in Europe would be produced in Europe. Oh, but these was written before Brexit. So obviously, English production plants had to be included. And England said, oh, no, we signed earlier, we invested more money, and these vaccines will not be leaving Great Britain. They will stay in Great Britain. So we started a great legal battle with the vaccines in England. And we start this post-Brexit battle. So this first confrontation with regards in matters of public health. I will not go much longer. I think I'm well over time. And I think I only had 10 minutes, but I will say 2 more things. What would have happened if we hadn't had this going? And I said the first consequence. The first consequence is, right now, our borders would be closed down. No country would have been able to buy from all these companies. Europe has obviously failed in some aspect. It failed in its selection, which is something that can happen. No one ever expected that the Sanofi Glaxo vaccine would fail. There were only 3 companies making vaccines before COVID. Pfizer, Sanofi, and Glaxo, and 2 failed. So obviously the Sanofi vaccine failed, and Pfizer had to be negotiated later. The Americans and the British negotiated it first, and Europe came in, but it took longer because they came in a bit later and had to pay for it with the delay of this whole thing. Moderna came into the negotiation very late, back when we were desperate because vaccines were not coming in, and AstraZeneca, I already told you. So obviously the first mistake was that we were not as ready as we should have been. Second mistake, we had no money. Europe had 2,700 million euro to purchase, whereas the US invested 18,000 million for a population which is half of Europe. So we're definitely talking completely different measures. That said, this is a success, and it's a success that can be looked at as follows. If it had taken us less time, maybe a month and a half, we would have saved lots of lives, which in itself is a failure. However, it is not quite as clear that the fact that the vaccination was delayed a month and a half, because we'll need to see what happened in the US, what happened in Great Britain, and obviously vaccines save lives. I would look at it from the positive side. I would look at the silver lining. Europe could open up. We can now keep countries open, not just for trade, but also for populations. And more importantly, if each country had been purchasing individually, we'd right now have the Eastern Bloc countries with Russian and Chinese vaccines, with what it would entail with regards to international relations with these countries. We'd have countries like Spain and Italy buying vaccines at a risk, so maybe with one of the available vaccines at individually negotiated prices. And therefore, that would have broken Europe, not just from the public health aspect, but also from the political point of view, because there would have been a vast difference when it comes to recovering trade, recovering the economy, and as well as the political influence of the member states. Thank you, Rafael Vila San Juan. He's already left us with some lessons from this year's experience in the pandemic. I'm sure Karma Colomina will teach us some more lessons and thoughts. Karma was also a very bad person in a previous life. She also used to be a journalist, and she's also gotten loads better in her current job. She's one of the analysts of our host of CIDOB, and she's a specialist in European Union and in something that has already come out in our first session, which is communication in the time of disinformation, not just bad information, but misinformation. So we've already pointed out some things such as the geopolitics of vaccines. Alessandro pointed at these new mechanisms, these federal debt, that for the first time that we were not able to do it during the Euro crisis, but we could do it now. And I'm sure Karma will have a lot more lessons to elaborate on from the European response to the pandemic. Take it away, Karma. Thank you, Anna. Thank you very much, everyone. Good afternoon. Good evening. So my first 10 minutes are going to be used to talk about communication. What has the European Union learned? Which responses have been set in motion, and what has it learned from the pandemic? And it's true that Rafa Vila San Juan was talking about the geopolitics of vaccines. And I believe that the first lesson has been an awareness of this geopolitical confrontation, which in the case of communication became dressed as this battle, this global story battle. As Josep Borrell, the representative of exterior politics in Spain, put it. And from my point of view, it's presented as this binarism between democracies and authoritarian regimes, which deep down has a lot to do with the propaganda capacity of each government, but is already pointing towards how this pandemic will later be told. And this is the first awareness in the European Union at the communication level, the story issue. And I believe we have this first entry point to this new vulnerability that the pandemic means. Confrontation in the global storytelling, and afterwards, the massive entrance of misinformation, the infodemic, as the WHO is putting it. And we're talking about health precisely. So we notice how lies not only erode democracies, and there's a political erosion that comes from lies, it may also have consequences on health. Beyond that, however, I believe there are three things that the European Union has learned. The first one is, how does the European Union's approach change through misinformation? And I will talk about that. And how do you realize that it doesn't have a working communication strategy, as Isabel de la Mata previously stated? And third, how is it betting on a normative response, which I will also get into? So let's take it one thing at a time. There's one image for me, which is the awakening towards this new vulnerability in March 2020, when Russian trucks crossed Italy's northern border to distribute humanitarian medical aid through planes to Rome, medical personnel through this huge label with the interlocked hearts with the Italian and the Russian flags and the phrase from Russia with love. And I believe this is the first facing to this new reality, this new political confrontation. That's when the European Union became aware that the story was getting away from them. Because after this first story, suddenly the European Union realized they were absent from the pandemic story, at the same time, when, as Isabel de la Mata was saying, the European Commission was already circulating ventilators among member states, when it had already sent medical personnel to Italy, member states in Europe were hosting in their hospitals patients from other countries. And however, what was the image that became viralized? Well, Russian trucks through the Italian border. And that was the new perception of this new vulnerability. The problem in the European Union was no longer misinformations, because the images of the Russian trucks are real. So the problem was not lies, but the ability to distribute the stories, the narrative, the propaganda. The European Union also had its own story, its own explanation of the pandemic, and it wasn't reaching people in the same way. That did not have the same ability to disseminate. And this is when the first lesson that everyone is really accepting at the European institution, which is because they themselves realized that their communication strategy needs to improve. It's not so much a matter of responding to these other stories, but as I was being told from the UE Council, to occupy the space, to occupy the communication space, which I believe carries with itself a shift in how the European Union wants to approach this from now on. The second thing is this change in approach with regards to misinformation, because starting in this new reality and this massive influx of misinformation, what had been being done the previous years from the European institution, which was to insist on how great technological platforms would put measures in place to close down accounts, to identify fake news and misinformation content, with the pandemic acceleration could take us to this situation of permanent and massive censorship of content. Because if efforts are all set on the distribution of content, then your political response goes there to what makes the European Union most uncomfortable, which is to limit freedom of expression, which also brought about a shift over the past few months in the strategy, in the political strategies at the European institutions, where the emphasis is no longer put on what, but on how. So it doesn't matter rather how do we stop, or where are the lies? What lies are there being said online? But rather, what techniques are behind them to amplify in such an effective way these content, this misinformation content? And this is what we're going to see over the next few months in relation to technological platform. We'll see the evolution for demand from implication from the great technological platforms, which doesn't focus so much on let's eliminate content, let's censor from private platforms, and rather putting the emphasis on how can we act in front of this ability to train these strategies to this multi-platform, multi-network, which carry with themselves this information and dissemination platforms. What else have we learned over these months that has to do with this need for rethinking communication politics, and that we can see that it can be translation post-pandemically? And I heard this week, and I'm going to quote a colleague, a fellow researcher. This week in Barcelona, we had a debate on the Next Generation EU, and maybe Alessandro will have something to say about that later. What effects may these post-pandemic funds have? And one of the possible effects that were being hinted at by Eulalia Rubio, who is an investigator at the Delors Institute in Paris, and we have also felt this, there is a certain euphoria at the European institutions, a satisfaction over what has been achieved with this Next Generation EU funds, because this is certainly an unprecedented instrument, which is being sold as a success, when actually we're still missing the most important part, the implementation and the analysis of the real effect they may have had over the economies that need it the most. So in 1, 2, 3 years from now, when someone has to evaluate the real success of these funds, how will this be carried out? Under which parameters? How will we prevent not going into narrative shock again? A battle over the story of the alleged success of the funds. More than a lesson we've learned. This is maybe a homework for what's to come next. What else have we learned? What else have we realized over these past few months? The arrival of new actors with misinformation, destabilization powers, Turkey, Iran, the United Arab Emirates, and China. China right now, also at the misinformation level, is the first perceived threat from the European institutions. And the European institutions also admit that China's disruptive capacity has been even higher to Russia over these months. And at the same time, they're a lot more vulnerable because right now within the European institutions, they are lacking the knowledge and the resources to face the Chinese capacity, even though they had already been dealing with Russian misinformation. If only because at the European institutions, there are few people who speak Chinese, so that diminishes the capacity for responding. So the new role of China clearly is a new reality that the European Union has awakened to, that's going to forward, will be something to keep in mind. Secondly, there's the vaccine issue. How have we gone from disinformation during the pandemic to disinformation about vaccine? And there's two things. The European Union realized that from the beginning of 2021, the misinformation campaigns originating in countries outside of the EU have increased in order to erode confidence in Western vaccines. And secondly, the ability from the anti-vax movements within the European Union beyond the origins of misinformation, whether it is, regardless of whether it is in or outside of Europe. And Isabel de la Mata talked about the French case, which I believe is the most meaningful one. And there are studies over the past few months, which link the lack of confidence in vaccines with a lack of confidence in those who need to administer these vaccines. And perhaps it'd be interesting to talk about this later, Rafael. Up to what point these generalized mistrust of vaccines, does it also stem from political institutional erosion, this confidence crisis in the institutions, which is also an internal realization within the European Union? Lessons we've learned, just very brief, and I'll be very brief. I think the first lesson the European Union learned, beyond the ones I was already pointing at, there's a need to tell about different kinds of misinformation, because each different kind will require a different response. It's not the same, something that comes between illegal content, hate speech against specific communities, whom you're accusing of spreading the virus, towards the misinformation, which is legal, because lies are not illegal. Lies are not punishable by law. So there are instruments. We do not have the legal instruments to act with regards to misinformation, which what wants to do is which is looking towards making money of things, or information with the purpose of creating public harm. So you need to distinguish what kind of misinformation you're talking about to decide on the strategy, on the resources you're going to need to attack it. Secondly, there's a need for cooperation more than ever. We try to intensify cooperation between the member states with the system of quick alerts, which was set in motion before the European elections. And these quick alert system was exported towards international institutions, G7, the World Health Organization, and the same quick alert with the NATO. So there's already the awareness of a need for multilateralism to stand against misinformation. And there's a clear response from the EU, which I think sets it apart from all the other great regions in the world, which is how the need to create protection and certainty in the European Union comes through regulations. What we've seen in these past few months is a normative arsenal, which has only become reinforced with the acceleration of the pandemic and the technological transformation. Oh, sorry, I thought it was my turn to finish. Okay, I see I'm in time. So with these technological acceleration, new needs present themselves. We've seen this at the level of the European Union, which is being discussed in the Council and the Parliament, the law for digital services and markets, which not only try to limit monopolistic behaviors on the large technological platforms, but also the spread of misinformation, as we were saying. And we've seen an emergence of this idea of technological sovereignty in the Commission, but also in the large European states. Germany has been using it much more. This notion of how can we have political leadership in the European Union, also in the matter of digital governance, and how this desire for digital governance knows it cannot stand unless it goes hand in hand with industrial technological innovation, with things that make us have an industrial policy that is also innovative. If we regulate without innovation, we'll fall short. And regardless of whether there's a digital strategy, the European Union finally realized that those who really have influential capacity at a moment like this are those who are, for instance, making the microchips which beat inside every digital product. So this normative arsenal has come with this proposal for innovation or renovation at the technology level, which what it wants is to strengthen this idea of the third way when it comes to facing off this combat, digital and technological contacts, which had been right now very, very bipolar between the United States and China. And what this third way is attempting especially is to serve as a regulation. How the digital confrontation for the European Union, it wants to be a normative battle, the ability to establish a regulatory frame, which we have seen over the past few months and which goes well beyond misinformation and propaganda and the control of communication, and it's to reinforce and dressed with specific policies. Thank you. So halfway between geopolitics and the perceptions, because we're in a time of misinformation and perception, Rafael mentioned Brexit several times. And I remind you that when that lady in Coventry was vaccinated and we started seeing the acceleration of the vaccinated population in the US, suddenly it was like Brexit 1, European Union 0. So the reaction in the European Union in that sense, it lost the first match in the Euro Cup because suddenly everyone was like, oh, the British did very well in leaving the EU because they're going so fast. Well, we haven't even gotten started here. And then also halfway between geopolitics and communication, when Biden arrives at G20 and says, we need to export to poorer countries. So suddenly he took a public opinion, which he didn't know that the EU was already doing that. And I mean, that's also up for criticism because they could say, well, why don't we start with our own people? And it looked like, oh, look, Biden, here is coming, such solidarity. Alessandro D'Alfonso, who isn't here physically, and so it's for him physically harder to interact. And I would say, if there's something he needs to add, or if there's some nuance, or he wants to interact with some of the things that Rafael and Karma have said earlier. And for starters, I would like to ask him something, which is, could you go a little more into detail, seeing how Spain was one of the first countries, one of the first recipients of this EU special fund? Up to what point what you were saying about how efforts will be made, larger efforts for transparency as to how these funds are used, if the necessary reforms as conditioned by these funds, these accountability, as we say it in English, could you go a little more into, very briefly, how these have been strengthened, and up to what point is it a challenge that lies ahead of each of the countries that will be recipients of these funds, these transparency and control?
Yes, thank you. Yes, these funds will be implemented and spent in a partially different way, meaning that money will be linked to milestones and targets. which are respectively qualitative and quantitative objectives. So the Commission will have to assess at regular points in time the achievement of these targets and decide whether payments can be made or not. But there is also a regular dialogue that has been included in the Recovery and Resilience Facility regulation, which is the largest instrument under Next Generation EU. And so under this regular dialogue, EU institutions meet regularly, and for instance, the Commission has to come to Parliament every 2 months to take stock of progress in the implementation of the plans, highlight possible problems, and so on and so forth. And then Parliament for the EU budget is also the discharge authority. So it ensures political scrutiny of how the EU budget is spent. And under the discharge procedure, Parliament will receive also reports on the state of advancement of spending for the national plans. So there are several mechanisms in place to improve and increase this transparency and accountability, especially as compared to intergovernmental instruments that were totally outside the EU budget. The advantage of linking the instrument to the EU budget is that there are already control systems in place to this end, and we can build on those achievements that are already there. As for commenting on what has been said, for instance, by Rafael, I would say that if Isabel is there, she would be possibly more entitled than me in commenting on Rafael's points. And as for misinformation, what Carme said, I'm Italian, and of course those images struck in the first place, but then I think that they were in a way soon forgotten in Italy. And then also patients that were transferred to German hospitals. And so the narrative has quite rapidly changed, I would say, also in the national press. Something that I would like to add as well is that, of course, the usual disclaimer applies, and these are my views and not the views of the European Parliament. Thanks.
Jo crec que el millor és que, si voleu complementar alguna de les coses que ha dit...
It's best if you want to talk about something that, you know, the others said, or something else you'd like to add, because I'm sure you have more to say. Be my guest. I think it's really interesting, the infodemic and how it's working on that sense. We've faced the greatest crisis in our generation. Never before had we had a crisis like this. I mean, maybe someone here in Spain still has a friend who went through the Civil War or Second World War outside of Spain. But I mean, not even our parents went through this. So before this emergency, obviously, all interests were shot off. And obviously, there's part of interest from those who want to, they're cut, who want to take advantage of the situation for personal gain. Indeed, the infodemic from the point of view of public health was brutal. It was so brutal that I have an amazing anecdote to tell. So I'm part of the International Committee for Gavi, the Vaccination Alliance. So when we launched the Gavi replenishment campaign to gather the funds to create COVAX, which Europe was the first push to create this multilateral platform that completely broke away from the multilaterality, which was not able to bring in the vaccines. On that first day, there was this person, Mark Zuckerberg, who made a donation of $50 million to COVAX. On the same day, we were checking how Facebook networks were only carrying fake information on the effects of vaccination, whether they were carrying chips or no, or what interest could lie behind vaccinations. So suddenly we thought, within this meeting for COVAX, we thought, well, instead of putting your 50 million here, put it in Facebook, and I'm sure your algorithms will help us more than 50 million before these 20,000 million, which is the current budget in COVAX for the purchase of vaccines. So we're obviously talking about two different things. One's business, and the other one is, philanthropy, or the ability to disseminate ideas. It is quite clear that right now we have a series of channels which are a lot easier to act than regular means. We have like a communication, a media, which has a visible network and social networks, which allows for a lot of anonymous people, which work much better when they have the full capacity to reproduce contents which have a greater impact. When they're negative, it is much easier to have a negative impact because you just need one idea to get inside. Whereas to unpick this whole negative content is a lot more difficult. So this is a very interesting battle that we're witnessing, and very difficult, because I'm sure all of you who are here hears that herd immunity is reached at 70% of immunization, which isn't true. And it's not true because a very simple fact, which is that it is calculated on the Wuhan variant and not the Delta variant, which makes us have to go up to 85%. So every emergency campaign, in every emergency in public health, there's one thing we know. In health emergencies, the first things to go down is the dosage of vaccination. That one is personnel, and at the end what we need is arms. If we don't reach 80, is because the battle has been won by this lack of information, which in part is fake, and which in a third part is culturally. And most interestingly, the two countries which are most reticent to the use of vaccines are France, which is the birthplace of Louis Pasteur, and India, which is where 65% of the quality vaccines in the world are produced. So these are the two countries which culturally, not because of this issue of, oh, I've been told there's a chip and microchip in the vaccines. Those of you who are familiar with France will see that there's a very important relationship with France, but at the same time, there is a very wide belief in homeopathy, which isn't science, but it may help, is a lot more effective than traditional medicine. So clearly there's a lot of in-betweens that we need to work on for sure. Well, actually, what the pandemic is making is just accelerating previously existing tendencies, which already existed in France 3 years ago. The Reuters Institute in Oxford, which also does this means assessment, media assessment. They already did a study on misinformation and studied the presence of misinformation content at certain European Union countries. And the French case, most of the misinformation content that was found in health-related digital media. And that was well before the vaccines, and we can't compare that. The audiences that they used to have with those who claim to have seen RT or Russia Today or Sputnik. So what the pandemic is doing is accelerating previously existing trends, and it also leads to a overexposition to the power of this great technological platforms, which is true that they earn a lot of money, but they encountered a huge reputation crisis that they were not counting on. And you brought up Mark Zuckerberg, and I think that's a very clear example. I don't remember if it's Facebook, but one of these companies during the pandemic appointed a vice president for human rights. While at the same time, they refuse to control an algorithm, which what it is doing is to amplify misinformation. The way I see it, post-pandemic, we will have any relationship with this technological platform. I believe they indicted themselves, no matter how much they may have collaborated, because one of the things we've seen during these months of pandemic is that the great technological platforms made a commitment to send monthly reports to European institutions with all the content they've identified as misinformative and what steps they have taken towards them. So they submitted themselves because for them it is easier to download content and send reports than rethink their business model. The algorithmic organization in the way they distribute information, which what it does really is to foster and give larger benefits to those news that are shared more quickly. And why are they shared more quickly? Because they appeal to emotion, because they're a lot more simple, or because they go beyond how they are formulated. And this is becoming, I believe, it has become a little unsustainable because they have really indicted themselves. I don't know what the real possibility for change really is. I believe without regulations, there will be no change. This is where the response comes from. Yeah, that's the response from the Digital Service Act. Yes, clearly that's where these kind of measures from the Digital Service Act are needed, because I believe that culturally, it's not just we as consumers are not prepared to prevent this, because this is also part of the communication game. We can know what they say, but there's a very clear example. When we found out there's this drug, hydroxychloroquine, which apparently looked like it might, be used to stop this. But first we said, well, we have the Institute in Global Health. We've been working with hydroxychloroquine for a long time. We know the secondary effects it has. This is a medicine that's rarely used for malaria. And we did not advise its use in the slightest because it did not have proven effects. So we went to hypermectin, which is another drug, which in Latin America, it was stated to be the solution for COVID. Depending on the dose, it may have a certain impact, but we published a report saying that, again, scientific information was being manipulated. Hypermectin was not approved, and we believe that the doses that had to be used were highly questionable with regards to risk-benefit. And this was completely devoured by the infodemic, and we started to be accused of promoting the big pharma because hypermectin is not subject to patent. It can be produced just by any lab. Just to give you an idea, our website becomes about 1 million views a month. That month, we reached 20 million just on the hypermectin page. And why? Well, because of misinformation. I believe that people, or at least I like to believe that people read the paper, but I don't know how it was used because we only saw terrible stuff about us being circulated. Please allow me to intervene because Carmen mentioned the Oxford Institute on the studies that they're doing about journalism. And only yesterday, I believe, they released a study according to which 40%, 4 out of 10 young people between 18 and 24 years old state that the information that reaches them is mainly through Instagram, Snapchat, and TikTok. Not through means of communication, not through, the websites of papers or the Instagram accounts, but rather through YouTubers, celebrities. So if David Beckham comes out and says something about vaccines, it has a much bigger influence than whatever a television broadcaster may say in the news or a newspaper may say. And it said that the WHO finds this alarming, so they created a virtual profile in Instagram to try and fight this and try to fight misinformation on vaccines and on COVID. We're talking about very real, very tangible things. Indeed, because another of the consequences we've seen is the social accountability from political and opinion leaders with the dissemination of misinformation, because if the thick of the misinformation that has been generated, the misinformative content generated during the pandemic was bottom to top, so maybe it had been created by anonymous citizens, 60% of those that has been most widely shared online was top to bottom. So misinformation, the misinformation that is really distributed, was the one that came from organisms, political leaders, or media leaders. That was the one that was really making the rounds, with less creators, but with a higher penetration capacity of what their message. So let's move on to the open questions, the same as we did in the previous session. We'll take one question from those who are in the room and then one online. Is anyone in the room who has a question? We have 3 speakers, I remind you. So those of you who have an interest in economics and geopolitics, in health, and Karma is here to lessons in the European Union and communication. Yes, there's the first raised hand over there. Hi, I'll introduce myself again. I'm Mar Lopez, a political science student at the Barcelona University. And my question is, what measures could the European Union take in the case that Spain does not fulfill, does not make good on the reforms it needs to do to achieve their European funding? I think that's a question for Alessandro, right? Yes, Alessandro. Did you hear the question?
Yes.
If the goals are not fulfilled, if we're not good, if we don't behave, what measures could the European Union?
Well, as you know, the plan was approved yesterday, and now the next step is the signature of a financing agreement between the Commission and Spain. And once this financing agreement is signed, 13% of the total amount of the instrument will be disbursed to Spain, so around 9 billion euros. Afterwards, there will be milestones and targets that have been agreed by the Commission and the Member State that will have to be achieved at regular points in time. And if there are delays, payments could be suspended if the achievement of these agreed milestones and targets are not met timely. And then if the situation is addressed, of course, the payment would be unblocked.
Pregunta online.
We have an online question. Yes, Michele Borra was asking whether the European Union, the donation it makes to vaccines through COVAX, have some geopolitical consideration. Well, right now, COVAX has 2 mechanisms at work. So for donations, whether in monetary or vaccine doses. Money doesn't have a name to extend. It's actually COVAX who decides what is the attribution mechanism. There are 92 countries who are receiving paid vaccines, who are receiving them. 100 million have been distributed until now, the 2,000 millions that need to be distributed until the end of the year. So we still have a lot of work. So we have raised the first 9,000 million euro, no, sorry, dollars. I always get mixed up. 9,700 million euro, out of which 8,000 will be for making the vaccines and 1,700 for the distribution of the vaccines. And the committee in Gavi is the decision maker for that. And it depends on 20% of the population. So we have the 92 countries with the lowest GDP in the world. And there's another mechanism called the dosage mechanism. So Spain has a certain amount of dosage that it has set aside to donate through COVAX because they don't have the logistics or the knowledge to give to this context. And they have demanded that these vaccines go to Latin American countries. So these vaccines will go through the 6 countries in Latin America that are in this list of 92 countries that will be getting vaccines from COVAX. For instance, Spanish vaccines could not go through COVAX to Colombia because they don't belong to these countries. There's Bolivia, Guatemala, Honduras, Haiti, Dominican Republic, El Salvador. So the countries with the lowest income in Latin America. France has done the same and has demanded that their money goes to Francophonie, whereas New Zealand has done the same for Southeast Asia. Regionally, this can be done. Doses exchange is very difficult because the dosage that the vaccines that Spain will donate, we don't know what maker they will be. So I give you 7 million Pfizer, 10 million in AstraZeneca, 6 million Moderna, and then 2 million Janssen. So how do I transport them? This is a very complex mechanism, and ultimately it will work out. It will all check out. But we don't know that the vaccines that Spain is donated, which isn't being donated by Spain, but rather by the lab, because Spain is making an order. I do not want these dosages that I ordered. You need to give them to COVAX, who will say, well, these need to go to this country. So these are the two mechanisms that we have. And right now, we are not accepting mechanisms, country to country donations. This is not off the table. A question from in the room? Hello, good afternoon. My name is David Carlo. I'm a student at the Montpellier University in France, and I wanted to ask a very general question. Do you believe that the European Union and the media have really disregarded the use of face masks after the vaccines became available? Because keeping in mind that covering one's mouth is a measure that is as simple as it is effective. And I believe it all became quite hasty, where people, once they were vaccinated, they decided to remove face masks. And most people took it as the end of the pandemic. Thank you. Oh, we really need Isabel de la Mata here because she's the one who really knows about this. Well, I don't know. I wouldn't say the media so much, even though media at the end end up reproducing the public debate around it. All I can say is that in my limited experience, Spain is one of the countries which is more disciplined with mask carrying. Because I've had real anxiety attack at the Heathrow airport back before we had the vaccine. Well, what I would say on the face mask, once the measure was implemented, people were convinced and people were scared. As the vaccines have progressed, people thought, well, this is it. We can take it off. Same as the restrictions. And we find ourselves in a critical situation where this is clearly not over to begin with. This is not over. We're around 46% vaccination rate total, because one dose is not the full vaccination. The second one, or in the case of a COVID, someone who has been sick from COVID, just one doses. So the risk is not gone. And we as a state, as a society, have decided that young people from 16 to 30 years did not need to be vaccinated until the very end, which was a decision that from the moment on when you decide to remove a series of restrictions, you suddenly have a population who is at a much higher risk of becoming infected. So it's you within this age bracket. So right now, there's a very important age bracket from 60 to 69 who have not been injected with a second dose yet in Spain. I'm not sure about France. And this is a population at risk, at a very high risk, until they get their second dose. So what we're trying to do is to get them vaccinated as fast as possible, because face masks are useful. They're efficient, not as useful as the vaccine, but it is a barrier method which prevents a first contact with the virus. Obviously, it is not as efficient as the vaccine, but this is the one measure we have in absence of others. And I believe that face masks will be the last of the restrictions that we will remove. I believe we'll see others fall in the first place. Yes, and I wanted to remind you all that there's been a great step forward in the coordination within the European Union. You were saying this is, people have been acted instead, they've been acted instead of 27 countries that were acting as one. And I would like to remind you, Spain is made out of 17 autonomic communities, and it's about 47 million people. And just think of just the complexity of these interterritorial meetings to come into agreement on the measures, restrictions, lockdowns. Well, the European Union is 27 countries and about 450 million people. So let's multiply the complexity of Spain reaching an agreement between the different health ministries at the European level. We have an online question. Jurar Zerin.
If I'm not pronouncing well your name and surname, asks Mr. Alfonso if the Next Generation EU instrument will become a permanent fiscal instrument in the future, and if this represents an important step towards the fiscal union.
Alessandro?
Yes, that's a very relevant question, but for the time being, it is a one-off instrument. It is agreed under the own resources decision, which is the decision that sets the financing system of the Union. And the decision specifies that this is really a one-off instrument. Of course, as also Carme was mentioning, implementation will be key, because now there will be this unprecedented level of resources channeled through EU budgetary instruments. So the result will be also important for possible discussions about a possible fiscal capacity for the European Union. But as you know, there are still positions that are quite different among member states on this point.
Take advantage, Alessandro. Profita. You have the floor, so for you it's more difficult to interact with the panelists. So if you have any question or something, you want to add something, just take the chance now.
Just to say that I agree very much with what Rafa had said. I also remember from the experience in Italy, the very first weeks with the outbreak of the pandemic. Another news that I would say angered the Italian public was that there were initial restrictions in the imports of protective material from other member states, but this has stopped luckily quite soon. And I would say that if the European Union had not taken care of a common vaccination strategy and common purchases for vaccines, this could have been really also an issue with possible competition among member states, while finally the crisis brought awareness that we are on the same boat in different respects. To fight the pandemic, to help our economies recover in a good and resilient way. So common action has proved very useful.
Pregunta a la sala.
Is there a question in the room? Do we have a raised hand around? Someone has any question for one of our panelists? Yes, good afternoon. My name is Xavier Lamarck, a student of Politics of Law at Pompeu Fabra University. And my question is regarding the Recovery and Economic Resiliency Funds from the EU. And it's a rather general question, so whoever feels compelled to answer. I don't know if you believe that these European funds will really have a positive impact on self-employed people and smaller companies, or they will really be handed off to great companies, large companies, because this is a discussion that is more and more prevalent in the public opinion. And I don't know if ultimately it's just big companies who will have the chance to reinvent themselves and renovate themselves with the green economy, whereas the smaller companies will not have, and whether you will be taking a stand on this. Yes, a very clear question. Alessandro? Oh, yes, I think Alessandro is the one who will have the best answer for this on the definition of these funds. So how do they reach whom? And there's something else I would say. With regards to what Karma was saying earlier, there is a big lack in good communication about what next generation is. Those who are working in it know what it is and know how you can get to these funds. If you ask my sister, who has a small company in Teruel, which is a small part of Spain, she has no idea at all. And when you tell her about next generation, she says, oh yeah, it's those restructuring funds. Maybe I can use them to put like windmills somewhere if they leave me because the regulations and this and that. Obviously, within the areas that we'll be working with, it's a matter of government, both at the state and autonomic level, to permeate not just the large companies, because these multinationals levels obviously have this highway into the funds because they have the capacity to access them, whereas smaller entrepreneurs and small companies don't. So we need to communicate this well. But it is true that many of these funds will be set aside for transformation, digital and environmental. So we'll see a large number of conversations where smaller and medium-sized companies will have to adapt, because ultimately those are the ones who can negotiate starting from the funding that they may receive. That is my opinion. I would like to add something and then sort of give Alessandro the floor. So mine is half an answer and half a question for him. From the beginning, we had been talking about how there's worry on the absorption capacity on some member states from these funds that they would receive. So now from the member states, this fear to the absorption capacity is lessened, but is adding to it, because presenting a project is easy. But the next doubt that comes is the systemic ability for transformation in the economy that these projects may have, which is where I think we'll see larger differences over the next few months, which takes me, or years, which takes me to add my question towards Alessandro. Because if right now we look at what demand for funds we are seeing from the member states, we see how those who already have a more healthy economy, they're demanding funds. The part of the funds that reach, you know, at a loss for benefits, and those who need it the most have to resort to funding and lending. So we're seeing that the debt level from the member states is highly unequal. The ability to handle the debt post-pandemic is going to be another challenge that will come with these funds, with the implementing of these funds and the recovery of economies, which will not happen equally. Again, this will happen rather unequally.
Alessandro?
Yes. I'm so sorry I'm not in Barcelona with you. I love your city, but possibly another time. Well, as for the funds reaching, for instance, small businesses, of course, it depends also on how national authorities have designed their own plans. For instance, in the plan approved for Spain yesterday, there are 3 billion euros allocated to the digitalization of small businesses. So under the macro objective of digital transition, there are these funds allocated, and there are other examples of funds that are addressed to small businesses. Of course, the plans are very broad, and so they include many different elements, not only companies, but also public administration, because in a number of member states, the digitalization of the public administration or the health sector are also challenges, and the plans are meant to address also these aspects. And then indeed, I think the key point will be whether the funds will be spent well, and for this reason there are these transparency and assessment mechanisms in place, because also as far as what Carme was mentioning, of course, when a member state requests loans, the debt level will increase as well. But if the funds are spent well, of course, we have a ratio debt gross national income. So if we are able to increase with these funds the gross domestic product of the member states more than the increase in the level of the debt, the ratio will decrease in any case. So implementation, again, possibly I've repeated it too many times, but will be a crucial aspect.
3 minuts per una pregunta i una resposta.
3 minutes for one last question online. Guillem Puigplanas asks about geopolitics. How do we counteract? How does the EU counteract the growing influence of China, Russia, and the Balkans? It's a good last question. Okay, the Balkans, right. Well, the EU is also asking itself that question, I think. How do we fight against that? And there are two aspects here, and one of them, again, has a lot to do with communication. The amount of propaganda or attention that is being given to China, for instance, is tiny compared to the money coming from the EU. And even so, we're talking about a much greater capacity for influence from them, which is true. Because if you look at how the external affairs councils in the EU for years have not been able to approve a critical resolution with China, except for the one we saw a few months ago with Xinjiang and the human rights, precisely with the companies operating there, there's a clear capacity for influencing the Balkans, which doesn't mean that that is aligned with real funding from China. And I think there is a clear political will from some EU member states to use these relations with China to serve as a counterweight, to send a message to Brussels that they too have an ability to be disruptive and to destabilize, as we've seen with Hungary quite clearly, I think. Well, I believe that we have seen, with the matter of the Eastern Bloc countries in Europe and the Balkans, but Eastern Europe, we've seen it very clearly, the situation where there was an obvious risk, which was a non-response, and leave these countries as if they were second tier, which I think clearly is what Europe should not do. But there's also a battle for the concept of human rights, Europe of freedom, of rights, etc., etc. That's also in play. And there's an open battle with regards to Hungary, Poland, with not just with the Chinese situation, with the influx from other countries. And I believe Europe is facing three great challenges, and it needn't focus on its influence, whether it's in the Balkans or not. And I think these challenges will set it up to compete on the global stage. The first one is climate change. We need to spearhead the climate change, especially in the face of someone as convinced as Joe Biden. And I'm sure a year from now, the majorities in Congress will change. So right now, he has some ability to maneuver, but we'll see how his ability to maneuver changes a year from now. This will not change in Europe. So Europe needs to keep spearheading climate change. Secondly, international security. And international security is not so much defense as it is global health right now. And this leads us to mechanisms that we have and we understand. We've never been the great military defendant in Afghanistan, but we can be the great champion of security through health. So obviously, to prevent COVID from having a greater impact in these countries, preventing new variants from coming up. And the third challenge is Europe can only grow through migration. It can never compete with China, but not in the Balkans. Anywhere we need roughly just to give you an idea, about 5-6 millions of newcomers yearly from now to 2050 if we want to keep Europe competitive. And this, well, short term is very difficult to explain. Long term, this is our only option. I believe these are our first great challenges that long term will have to position Europe in the world, which will only make us regionally and locally. This is the only thing that will keep us competitive differently from China and the US. Okay, we went just 2 minutes over time. That's 2 tiny minutes from the allotted time. Well, this is where our first session ends from our first summer school. Thank you very much to our speakers. Thank you, Karma. Thank you, Rafael. Thank you very much again, Alessandro. Thank you to CIDOB, and we'll see you tomorrow. Tomorrow at 10 o'clock, we'll be starting with our sessions. So see you again here at 10 in the morning.
Muchas gracias.